Nurse Aide Test Prep Grade 2. Question 1. A client with a history of falls has been repositioned. The nurse aide should also ensure: Option A. The bed is in the highest position. Option B. The room is completely dark. Option C. The bed is in the lowest position and the brakes are locked. Option D. The client's family is called. The correct answer is option C. The bed is in the lowest position and the brakes are locked. The bed should be in the lowest position to reduce fall injury risk, and the brakes must be locked. The room should have adequate lighting. Calling the family is not part of the safety routine. Question 2. Standard precautions apply to which bodily fluids? Option A. Blood and blood products only. Option B. All body fluids, secretions, and excretions. Option C. Only visible blood. Option D. Only if the client is diagnosed with an infection. The correct answer is option B. All body fluids, secretions, and excretions. Standard precautions apply to all body fluids, secretions, and excretions, except sweat, regardless of visible blood, treating all clients as potentially infectious. Question 3. A client with dementia is pacing and appears anxious. The nurse aide should: Option A. Restrain the client to prevent falls. Option B. Encourage the client to sit down and rest. Option C. Walk with the client in a safe area. Option D. Leave the client alone. The correct answer is option C. Walk with the client in a safe area. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Pacing is a common behavior in dementia. Restraining increases agitation. Forcing the client to sit may escalate behavior. Question 4. A client becomes upset and tearful while discussing their recent diagnosis. The nurse aide should: Option A. Change the subject to something more positive. Option B. Tell the client to stop crying. Option C. Sit with the client and allow them to express their feelings. Option D. Leave the room to give the client privacy. The correct answer is option C. Sit with the client and allow them to express their feelings. Allowing the client to express emotions and providing a supportive presence validates their feelings and helps them process difficult information. Changing the subject dismisses their feelings. Telling them to stop crying is insensitive. Question 5. A client at risk for pressure ulcers should be repositioned how often? Option A. Every hour. Option B. Every 2 hours. Option C. Every 4 hours. Option D. Once a shift. The correct answer is option B. Every 2 hours. Clients at risk for pressure ulcers should be repositioned at least every 2 hours to relieve pressure on bony prominences. Repositioning every 4 hours or once a shift is insufficient. Question 6. A client with dementia has difficulty eating. The nurse aide should: Option A. Feed the client quickly to ensure adequate nutrition. Option B. Allow plenty of time and provide cues to eat. Option C. Puree all food to make it easier. Option D. Skip meals when the client is resistant. The correct answer is option B. Allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example: pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 7. A client is angry and yelling. The nurse aide should: Option A. Yell back at the client. Option B. Leave the room and return later. Option C. Listen to the client's concerns and remain calm. Option D. Call security. The correct answer is option C. Listen to the client's concerns and remain calm. Active listening without defensiveness de-escalates anger and shows respect. Yelling back escalates. Leaving may be necessary if the client is a danger, but listening is the first approach. Security may be needed if the client is a danger to self or others. Question 8. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should: Option A. Redirect the conversation to something more pleasant. Option B. Provide active listening and allow the client to talk. Option C. Tell the client not to worry. Option D. Change the subject to the client's care. The correct answer is option B. Provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 9. The client's call light should always be placed. Option A. On the bed. Option B. Within the client's reach. Option C. On the client's right side. Option D. Over the side rail. The correct answer is option B. Within the client's reach. The call light must always be positioned within the client's easy reach to ensure they can summon assistance when needed. Placing it over the side rail or in a specific direction doesn't guarantee accessibility. This is a critical safety measure to prevent falls when clients try to get up unassisted. Question 10. A client is grieving the loss of their spouse. The nurse aide should: Option A. Tell them to move on and focus on their health. Option B. Listen and acknowledge their loss. Option C. Avoid mentioning the spouse to prevent sadness. Option D. Suggest they should be grateful for the time they had. The correct answer is option B. Listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated. Question 11. When should the nurse aide count an apical pulse for a full minute? Option A. Always. Option B. Only if the client is pediatric. Option C. When the pulse is irregular. Option D. When the client is sleeping. The correct answer is option C. When the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 12. When a nurse aide is floating to a different unit, they should: Option A. Refuse to float to an unfamiliar unit. Option B. Accept the assignment but only do familiar tasks. Option C. Accept the assignment and ask for orientation to the unit. Option D. Accept the assignment and perform all tasks independently. The correct answer is option C. Accept the assignment and ask for orientation to the unit. Floating is normal, but the aide should request orientation to the new unit. Refusing may be insubordination. Doing only familiar tasks may not meet client needs. Question 13. The apical pulse is located at the: Option A. Wrist. Option B. Neck. Option C. Apex of the heart, 5th intercostal space, midclavicular line. Option D. Elbow. The correct answer is option C. Apex of the heart, 5th intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the 5th intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 14. When a client is being discharged, the nurse aide should: Option A. Assist with packing and ensure the client has their belongings. Option B. Tell the client to call if they need help. Option C. Let the client pack alone. Option D. Rush the client to leave. The correct answer is option A. Assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 15. A client's oxygen saturation reading on the pulse oximeter is 95%. This is: Option A. Below normal. Option B. Normal. Option C. Above normal. Option D. Requires immediate reporting. The correct answer is option B. Normal. Normal SpO2 is 95 to 100%. A reading of 95% is at the lower end of normal but is acceptable. Readings below 90% require immediate reporting. Question 16. A client expresses fear about an upcoming procedure. The nurse aide should: Option A. Tell the client not to worry. Option B. Acknowledge the fear and offer support. Option C, change the subject. Option D, tell the client the procedure is minor. The correct answer is option B. Acknowledge the fear and offer support. Acknowledging and validating the client's fear provides emotional support. Dismissing or minimizing the fear, A, D, is not therapeutic. Changing the subject, C, avoids the client's concern. Question 17. A client has had a stroke and has left-sided weakness. The nurse aide should: Option A, place items on the left side to encourage use. Option B, place items on the right side where the client can reach them. Option C, ignore the weakness. Option D, restrain the left arm. The correct answer is option B. Place items on the right side where the client can reach them. Place items within reach on the stronger side to promote independence. Encouraging use of the weaker side is appropriate but should not be forced. Restraining is not appropriate. Question 18. A client is having a seizure. The nurse aide should: Option A, put a spoon in the client's mouth. Option B, hold the client down to stop the seizure. Option C, clear the area and turn the client to their side. Option D, leave the client alone. The correct answer is option C, clear the area and turn the client to their side. During a seizure, clear the area, turn the client to their side to prevent aspiration, and protect the head. Putting anything in the mouth can cause injury. Holding the client down can cause fractures. Question 19. When receiving a report at shift change, the nurse aide should: Option A, ask questions about unclear information. Option B, write down everything quickly and leave. Option C, ignore information about client preferences. Option D, rely on the previous aide's verbal report only. The correct answer is option A. Ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 20. When assisting with meals, the nurse aide should: Option A, place the food tray on the bed. Option B, place the food tray within easy reach on the overbed table. Option C, feed the client immediately. Option D, leave the tray for the client to manage. The correct answer is option B. Place the food tray within easy reach on the overbed table. The tray should be within easy reach so the client can self-feed if possible, promoting independence. Placing on the bed is unsafe and unsanitary. Feeding immediately may be unnecessary if the client can self-feed. Question 21. When assisting a client with a bath, the nurse aide should: Option A, bathe the client from cleanest to dirtiest areas. Option B, bathe from the feet up. Option C, wash the perineal area first. Option D, use one washcloth for the entire body. The correct answer is option A. Bathe the client from cleanest to dirtiest areas. Bathing from cleanest to dirtiest, face first, then upper body, abdomen, arms, legs, and perineal area last, prevents spreading microorganisms. Using one washcloth for the entire body is unsanitary. Question 22. A client expresses sadness about not seeing their family. The nurse aide should: Option A, tell the client they will visit soon. Option B, allow the client to express their feelings. Option C, change the subject. Option D, call the family immediately. The correct answer is option B. Allow the client to express their feelings. Allowing expression of feelings validates the client's emotions. Making promises, A, may be false. Changing the subject dismisses the client's concerns. Calling the family, D, may be appropriate but is not the first therapeutic step. Question 23. After giving a client a back rub, the nurse aide should always note: Option A, the last time the client had a back rub. Option B, any change in the client's skin. Option C, the client's weight. Option D, the amount of lotion used. The correct answer is option B, any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 24. When feeding a client who has difficulty swallowing, the nurse aide should: Option A, feed them quickly to minimize aspiration risk. Option B, place food on the affected side of the mouth. Option C, place food on the stronger side of the mouth. Option D, use only liquids. The correct answer is option C. Place food on the stronger side of the mouth. Place food on the stronger or unaffected side to help the client control and swallow. Feeding quickly increases aspiration risk. Placing food on the affected side can cause choking. Only liquids ignores the ordered diet consistency. Question 25. A client tells the nurse aide that they want to harm themselves. The aide should: Option A, keep the information confidential. Option B, tell the client that they are being silly. Option C, report it to the nurse immediately. Option D, promise the client that everything will be fine. The correct answer is option C. Report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm.